to the Healthier Washington quarterly webinar. Today's webinar is about fostering connections for providers. There are multiple ways to connect with the webinar, and then also multiple ways, one way for you to ask us questions today. We are going to take questions at the end of the webinar through the questions panel that you can type into at any time, as well as at the end when we are taking questions. We encourage you to stay engaged throughout, and hopefully this can be somewhat interactive. Today's presenters are Dr. Daniel Lessler, the Chief Medical Officer at the Healthcare Authority, Mary Beth Brown, the Director of the Practice Transformation Support Hub, which is housed within the Washington State Department of Health, Selena Bulletin, the Director of Quality Health Practice Transformation, Dr. Ian Bennett with the UW Department of Family Medicine and Psychiatry and Behavioral Sciences, and Melissa Bomke with the Pediatric Transforming Clinical Practice Initiative, which is also housed within the Washington State Department of Health. I'm Laura Kate Zeichkin. I'm HCA's Deputy Chief Policy Officer, and I will be introducing today's webinar as well as taking questions and facilitating some questions at the end of the webinar. So what we'll cover today, this is a webinar that's focused on clinical practice transformation. So we'll start off with what is Healthier Washington and why is practice transformation important to the work of Healthier Washington. And then we'll hear from our panelists about opportunities and resources available to help clinical providers transform. And these are just a snapshot of some of the things that are available out there among the wealth of practice transformation resources that are available in Washington State. So we'll cover a bit about the Medicaid Transformation Demonstration, the Practice Transformation Support Hub and Portal, and then also hear about experiences and what's going on in the field around Transforming Clinical Practices Initiative. So first, a bit about Healthier Washington. You will recall that Healthier Washington is the state's health systems transformation strategy to improve the health and health care of all Washingtonians in this state. We have three strategies. We focus on paying for value, we focus on whole person health, and we also have a strategy around empowering communities to drive transformation at a local level. Practice transformation is necessary and critical for all of the Healthier Washington strategies and initiatives. Without providers, we will not be able to achieve our goals under Healthier Washington around whole person care, paying for value, and healthier population. So in the context of Healthier Washington, practice transformation encompasses the way in which care providers are changing the way that they do business in order to focus on better outcomes for people and their families. Within Healthier Washington, we're going to focus quite a bit today on clinical practice transformation. But when we talk about practice transformation in Healthier Washington, we also think about shared decision making and workforce strategies that are really critical in order to achieve the goals and the aims of Healthier Washington. So with that, I am going to turn it over to Dr. Lessler to introduce a bit of why we need clinical practice transformation and also a bit of a preview of the opportunities that are available.
Thank you, Laura. In terms of why practice transformation is important, Laura hit upon the two key stakeholders here, being providers and patients. And I think from a provider standpoint, at least those in the provider community I talk with are really very tired of being on a hamster wheel and having to run faster and faster. At the same time, I think people would acknowledge that our delivery system doesn't always deliver the results that we would want on behalf of our patients. So we really need to be rowing in a very different direction, and hence the cartoon in this slide. So what does the current healthcare system look like? Well, to begin, it really is what you get when care is driven by a financing system that is primarily fee-for-service. And what that has done is really to segment or fragment care delivery. I think there's no better example of this than the way in which we separate the head from the body in terms of how we deliver care. So we really have separated out physical health, mental health, chemical dependency, as if they weren't all occurring in the same individual. And one result of that is that for people with serious and persistent mental illness, their average age of death is in their 50s, usually from cardiovascular disease. So they die 25 years younger than the general population. And as I mentioned, the current incentives really drive volume, but not quality outcomes. And as I think people have heard over and over again, our system just continues to get more and more expensive, now approaching 18% of our GDP. I think this next slide is just one sort of more Washington-based example of how the current system of payment leads to less than optimal quality. And this actually is an example of unexplained practice variation. And what we see in this slide, and this is with data from the Washington Health Alliance, are variations in rates of hysterectomy across the Puget Sound region. And so you can see that the blue are lower rates and the red are higher rates. And you can see that across the Puget Sound region, for no obvious clinical reason, women are much more likely to have a hysterectomy in one community than they are in another. And really, I think this is an example of what you get in terms of how we currently pay for care, because the payment system ultimately drives what delivery on the ground looks like. So what are we driving at in terms of going from a volume-based or fee-for-service-based system to a value-based system? I think if you look at the right side of this slide, it really captures sort of the key elements of a transformed system under value-based payment. So this is where really we're integrating the financing and using financial integrations to drive changes in how care is delivered on the ground to get better clinical outcomes, better outcomes through more coordinated care, greater attention to transitions of care, more activated and engaged patients, and better measurement and standardization around practice. So that's by way of background. And now I want to talk a little bit about the tremendous opportunities that we have in the state, and focus here on the what we call the Medicaid Transformation demonstration. And the Medicaid Transformation demonstration really is an opportunity for providers to move to value-based care, care coordination, and population health management. It is a key effort of Healthier Washington, and what we have is the opportunity to invest up to $1.5 billion that can come to this state if we are able to actually transform how care is delivered and reach milestones. This is a 5-year demonstration project to implement innovative strategies for clinical practice. and really is a contract with the Center for Medicaid and Medicare Services. There are three large sort of components to the demonstration. One has to do with transformation through accountable communities of health, which I'll speak to in a moment, and that's where provider engagement and clinical practice transformation on the ground would be occurring. And then there are two other components. One is around long-term services and supports, and really the idea here is to maintain people at home as long as possible. So trying to avoid institutionalization of people who might have chronic illness or be more feeble in terms of their well-being. And then finally, a component focused on foundational community supports, and this is what we refer to as supportive employment and supportive housing, and supportive. These really being efforts to wrap around services to people so that they can successfully be housed and successfully be employed. So I want to just talk a little bit more about. We can show all the different components here. So just bring up the full.
They see it.
Okay. Talk a little bit more about the first set of projects that I spoke to in terms of transformation through accountable communities of health. So accountable communities of health, or ACHs, are entities that can convene local communities with the idea of improving the, writ large, the health status of that community. And one way of doing that is by improving the care that patients in those communities receive. So there are 9 ACHs across the state that bring together different stakeholders, as shown here, and they actually have 8 projects to choose from, 8 project areas that they can focus on. 2 of which they're required to focus on: a project having to do with addressing the opiate epidemic, and a second project addressing behavioral health integration. And then there are a number of other projects that are optional. They need to do at least 4 projects. Those other projects are things like care coordination, care transitions, access to oral health services, chronic disease prevention and control, and so forth. I won't go into any detail today about those. But the idea here is that the ACH, working with partners, selects the project areas and the project content to work on, and then brings the community together to actually implement that project. So you can ask, so how does this get paid for? Well, as mentioned, for this slice of the Medicaid Transformation demonstration, we have up to $1.1 billion. Now this is actually paid for not as if it were a grant, but much more as if it were a contract, in the sense that ACHs, as they implement projects, will get incentive dollars when they meet milestones. So as they accomplish certain goals along the way, then the money flows to the ACHs, and from the ACHs out to community providers. So that's the way in which the way in which the incentives and the dollars flow within for the demonstration. So what can providers do at this point in terms of the demonstration? Well, we think at the first step is connect to your local accountable community of health, and you can learn more about how to do that by just going to this Healthcare Authority Healthier Washington webpage, and you can get details about the accountable community of health in your community and how to connect to it. So with that as background in terms of practice transformation and the role of the demonstration, I want to turn it over to our hub director, Beth, to talk more about the Practice Transformation Hub and how it can support providers in transitioning to a value-based payment world.
Thank you, Dan. I'll talk a little bit about the Practice Transformation Support Hub, which is an investment area stood up under Healthier Washington with the State Innovation Model funding that supports us through January 31st, 2019. But as Dan just described, there are a lot of opportunities out there for providers, both through the demonstration projects, and as you know, incentives and value-based payment options are becoming more common, and clinical providers need to respond in such a way as to move toward those opportunities and support their patients and move toward the triple aim. So the hub was set up specifically with three goals in mind that align well with the demonstration project that came afterward. First, to help providers integrating behavioral health and physical health bidirectionally, to help providers move from value-based payment to value-based care, volume-based payment to value-based care, and then also to help you with improving population health through access to clinical resources, and then also connecting providers to one another and sharing best practices across the state. So the way we set up the hub, and we have representatives with us today, both from Qualis Health and University of Washington, to talk about the different parts of the hub. But we set it up as three components to support the provider community. We have two contracts with Qualis Health. One is for something called for the Regional Health Connector Network, and then the other is for practice coaching, facilitation, and training. So in each of the ACHs, Qualis Health has a coach connector who both provides direct hands-on coaching to practices that enroll, and then also will work with any practices that come forward with questions about technical assistance and resources that might help them with their needs. And then we also have a web-based resource portal, and Dr. Ian Bennett is with us today to talk about that resource. And it's a curated resources of practice transformation resources that providers can use in their practice transformation journeys. So thus far, we've been on the ground for 6 to 7 months, and what you'll see in the accountable communities of health is you'll have one very active coach connector that you can work with. The resource portal was launched last January and goes through changes regularly, and we'll have a second version going live at the end of the year. We have been working with other practice transformation initiatives to align resources and our outreach to providers so that you understand that there's no wrong door to getting support for practice transformation. So Melissa will be speaking with us later about the Transforming Clinical Practice initiatives that are active in our state, along with the Hub Coach Connectors. And you can talk with any one of those representatives in your region and find the right fit for you for your practice transformation work. Currently, we have more than 100 clinics, both behavioral health and primary care, as well as a couple standalone substance use disorder clinics that are enrolled with coaches with Qualis Health. We have the UW-AIM Center as a partner to Qualis, and they've been delivering a learning series in the last several months to behavioral health providers and primary care providers interested in moving along the continuum for integration. And we've been reaching out to our accountable communities of health partners to see how we can support them in their work around the demonstration project in working more effectively with providers. And we continue with thoughts for sustainability after our funding ends, looking for practices that are very successful, either with behavioral health integration or adapting to value-based care, so that we can identify model practices and make those resources available to other practices who might want to visit them or learn about what they've done and what has worked. So part of our work is, in addition to the hands-on coaching, we offer training and webinars, and you'll see our upcoming events. In July, we have a popular topic, so financing and sustainability for behavioral health integration, what can get paid for and what can be reimbursed, so it can lead or support your decisions about how to transform your practice. And then later in August, there'll be more about behavioral health integration And in November, we'll be looking at how to integrate your practice transformation work across measures, across payers, so that you have one action plan that works for you and you can address lots of audiences with your practice transformation work. We also have been working with our tribal partners to set up a learning series with the EWA Center for tribal clinics and the urban Indian health organizations that we hope will launch in the fall, in September. We also have one-day trainings on either side of the mountains. So we'd like you to save the date for those. The registration is currently open. We'll have one event in Tacoma on September 25th and the other in October in Moses Lake for our Eastern Washington providers. We will have 3 tracks in those day-long sessions, one for primary care and integration issues for primary care setting, one for behavioral health and integration for behavioral health agencies and substance use disorder clinics. And then we'll have another track on value-based payment related to integration. So now I'd like to hand it over to Selena Bolatin, the Practice Transformation Director at Qualis Health, to talk more about the resources that Qualis offers to our providers.
Thank you, Mary Beth. Could I have the next slide, please? Just want to give a little bit more detail about our menu of services for practices, and this, of course, includes primary care and behavioral health providers. And I think one of the differentiators for the hub services is on-site practice coaching, where our coach connector can come in, meet with the team at the practice or the behavioral health provider setting to talk through goals and pain points and starting places. One of the ways that we do that is through personalized practice assessments. We use the patient-centered medical home assessment as that's really a foundational set of concepts for value-based payment and also for integration kind of activities. And then we also have access to the main health Access Foundation or MEHAF assessment, which specifically helps practices and behavioral health providers see where they are on the continuum of behavioral health integration. From those assessments, we generate individual reports and recommendations and work with the practice or the provider setting around action planning for next steps. Mary Beth already talked about education. We have many tools and resources. We link closely with the resource portal around many of those tools and resources so that on an ongoing basis, practices and providers can access different resources. And then we also have really scanned the individual accountable community of health areas around resources and for community-based linkages. And I can give a quick example of a physician who didn't seem to have a place to send his Medicare patients who were grieving or going through some depression, and the Coach Connector found several behavioral health providers in the community who were accepting Medicare patients and connected together around those referrals. Next slide. So I'll just say a little bit more about, because we have a diverse set of services to meet those needs around behavioral health integration, preparing for value-based payment, and clinical community linkages. So if I just kind of go around the circle to just a couple of these topic areas here, in terms of helping to support physical and behavioral health integration, we can help practices and providers with workflows around and training around screening for depression, for example, and tracking improvement, adjusting treatment for behavioral health, and then supporting improved care coordination. And I just want to point out that we support any behavioral behavioral health approach, not a particular approach. We work with the AIMS Center, which developed the collaborative care model, which closely overlaps with the BRIE collaborative recommendations. So we see it as a continuum, and we want to start where the practice is at and take those small steps towards integration. So if I move around a few more slots to the managing population health, that might be improving reporting capacity or helping develop more robust impanelment processes and utilizing registry to support impanelment for population health. And then if I move over to about the left-hand side there, leveraging community connections, that's some examples there as we've connected primary care practices with close-by behavioral health agencies so that they could start working together more closely as one of those steps towards integrating behavioral and physical medicine, and then connecting practices to the accountable communities of health, since that'll be some important initiatives for them to be aware of and participate in. So I'll stop there, and Mary Beth, I think you were going to introduce Ian.
Sure. Thank you, Selena. Now I'd like to turn it over to Ian Bennett from the University of Washington, and he is the principal investigator for our web-based resource portal. Ian?
Thanks, Mary Beth. Hi, everybody. May I have the next slide? So today, I'm one of the co-directors of the portal, as we call it. It's the third part of the hub, as been mentioned before. And we are basically an electronic resource that pulls together many of the tools and other kinds of resources, training approaches, and background materials that really support how to move forward with the practice transformation efforts that are the heart of Healthier Washington, the hub, and everything that we've been talking about today. So the resources the portal aspires to be a one-stop resource where you can go and find key resources and key starting points, even if your path will have to take you elsewhere, that we are organizing things around this effort to be able to help people understand and navigate the various aspects of practice transformation in a format that is easy to manage and easy to get information quickly. This first slide is giving you a picture of the top of our homepage, and I encourage everyone to go, if you get a chance, to the portal itself. It's waportal.org, so WA for Washington, portal.org. And what you'll find when you go there is a lot of information basically about all the efforts that we have underway. There's a resource page that allows you to actually search. It has a search wizard that allows you to move around and find the resources that you're interested in. We have a lot of information that ties people together related to the news of the portal and the news of the hub, I should say, and other aspects of practice transformation, things that are going on that are not necessarily directly part of the hub, but are related and support our efforts overall. An important element of this of the portal is it's a conduit. It's a way to sign up for resources and support from the Qualis Health efforts that are underway. That includes the two elements that Selena had mentioned earlier, the practice coaching as well as the regional connectors. Next slide, please. So here it's a little information about what our goals are. It's the go-to website for Washington State healthcare practices looking to stay informed and engaged in practice transformation, so-called bidirectional healthcare delivery, which is actually is bidirectional behavioral health integration. And what that means is that we're supporting the integration of behavioral health into primary care And on the other side of that direction, the other part of the buy is getting physical health care into behavioral health centers, so community mental health and freestanding substance use treatment centers, and also to help with understanding and getting ready for the new payment models that are on the way. Next slide, please. So if you do have more information about this resource, please use this information. You can go directly to the hub. You can also go right to the portal itself. That's what I would recommend, and that you can just type into your browsers waportal.org. There are other kinds of practice transformation support. There's some links there, but you can really get to all of that just from the portal itself. And I'll just put in a little plug for the way that we curate, as was mentioned earlier, the resources that are available to people. We actually use what's called a participatory approach. We actually hire people from across the state from clinical practices to participate in the curation process, the identification of resources that are meaningful and appropriate for the kinds of practices that they come from. And these are small to medium-sized primary care practices, as well as community mental health centers. And those are the folks who are helping us identify what the right resources are, so you don't have to spend your time sorting through things, but actually can go to trusted resources to begin with. So we'd like to finally invite anyone who might be interested in joining that curation process to get on the portal and send us an email through the communication sites there and let us know about you. And we'd love to get you started helping us with creating the portal itself. And that's the end for me.
This is Beth Brown again, and I'd like to introduce Melissa Tempe, who is here with us from the Department of Health and the Transforming Clinical Practice Initiative dedicated to pediatrics. As we said earlier, there are many opportunities for practice transformation in the state, and Melissa can speak to the other initiatives that we're working with through the hub, and just to emphasize the fact that our hub connectors are out there to help you find the best fit of resource, and that would include our partners in the Transforming Clinical Practice Initiative. Melissa.
Thank you, Mary Beth. So the Transforming Clinical Practice Initiative is another, we call it a practice transformation network in Washington State. It's actually a federally funded initiative that was brought about by the Centers for Medicaid and Medicare, CMS. And the purpose is to help clinicians achieve large-scale healthy transformation, which means going to a value-based care system. The initiative is going to support more than 140,000 clinician practices, and that's over the next 4 years. And it came to pass because the Affordable Care Act passed. And so we knew, as Dr. Lessler was saying earlier, that we needed to give better care to our patients, but we also needed to save money while giving that care. So it's focusing on a new way to do that. So in Washington State, there are 4 practice transformation networks total. There is the National Rural Health Accountable Care Consortium. There is Peace Health Medical Center. There is the University of Washington. And then there is the Washington State Department of Health. And we are unique because we are focused on pediatric care. So that is why we are the Pediatric Transforming Clinical Practice Initiative, PTCPI, instead of just the TCPI. Say that 5 times fast. So we are focused on the overall goal of value-based care and bringing pediatricians and family practices in the state of Washington to go to a value-based care model. But on the way to that road, we are focused on improving well-child rates. We are focused on improving the rates of asthma care plans. We're focused on improving the rates of vaccinations. We're focused on improving behavioral health and access to specialty providers. And then we're focused on decreasing unnecessary ED visits and decreasing unnecessary hospitalization. So for example, the PTCPI is divided up into regions, and so we have what's called a practice facilitator in each of the 9 ACH regions, and that practice facilitator is sort of in charge, if you will, of a regional team. And so the regional team has a provider champion, a behavioral health champion, and a representative from Molina. And so they work together on recruiting clinics to join our initiative, and they work on sort of figuring out what providers in our state are looking for as far as transformation goes. So far, we have 111 enrolled clinics. We have 37 specialty clinics, 74 primary care clinics, and we have a total of 1,152 clinicians who are currently enrolled, and a total of 967 primary care clinicians enrolled. And there's actually, so let me just go back to that. There is 1,152 total clinicians, specialty and otherwise. 967 of them are primary care, and 185 are specialty care. So thanks. Thanks, everyone, for your active participation in the panel, and then also we have been getting questions throughout the panel. We do have our panelists available to answer questions, and so I would invite everyone on the webinar to submit those at this time. While we're waiting for a few others to come in, I'll start with the ones that we questions that came up throughout. Melissa, I'm hoping that you can expand a little bit more on sort of the value that providers are seeing from the pediatric PCPI and what some of the results are so far.
Absolutely. So in the pediatric PCPI, the first time you meet with practice facilitator, they complete a practice assessment tool. And that tool is a great way for them to see where their practice is succeeding and what areas they want to improve upon. And then the practice facilitator can take an individualized approach with that clinic and look at, okay, you want to decrease your ED visits. Well, can we look at changing your hours? Can we look at your workflow plan? Can we look at giving out literature for your patients so that they know what expanded hours you have? And then what we are seeing is we are seeing actually a decrease in ED visits, and we're seeing an increase in well-child rates. And I think that has a lot to do with the individual practice facilitators being able to take that individualized approach within their clinic.
Thanks, Melissa. Mary Beth, you spoke to alignment and sort of this no wrong door in making connections. Can you speak a little bit more to where providers will see alignment as opposed to a lot of different initiatives that look really different and feel really different across the state? And what are the steps that the hub and others are taking to ensure that this is as easy as possible for providers?
Well, we know that the providers are hearing from lots of different parties with offers of help and different initiatives, and we're doing our best, both at the state level through a group we call the Practice Transformation Consortium, and then also with our connectors in each of the accountable communities of health, to make it our responsibility to canvass each ACH and figure out what's happening in each area and have those contacts for technical assistance coordinate with each other. If it's not happening, what we would ask, if you're confused about a request, look for your hub connector, and they can do the work to track down what that offer is and whether it's a good fit for your situation if you don't have time to assess the different offers that you have. That's one of the roles that the connector can play. So keep in mind that the Call Us Coach connector can come in and help you with your action plan and do intensive coaching, but they also can just help you understand what is happening in your area, including what's happening at the accountable community of health and how it might affect you, or what the opportunities might be with Transforming Clinical Practice Initiative partners. So I don't know that we know everything that's happening because there's something new so frequently, but we are trying to stay ahead of that and be sort of an ambassador and liaison for the providers to the extent that we can.
Thanks, Mary Beth. Is it possible for a clinic or a provider to participate in more than one of these practice transformation opportunities?
It's a very good question. And again, the Practice Transformation Consortium is a leadership group at the state level that the Hub has convened with our TCPI partners and other key players in practice transformation around the state. And it's really rather complicated. So what I would suggest is that you assume that the Hub can work with any other initiative, because the SIM resources, the way we're funded, does not restrict our collaboration with our TCPI partners. Two TCPI coaches, however, generally cannot work in the same setting. But I wouldn't make those decisions without talking to your connector and your ACH, and they can help you assess and make sure that the fit of technical assistance is done in such a way that it's acceptable. And really the burden is on us, the providers of the assistance, not on the providers to sort that out. So I would just encourage providers to ask for the help you need and leave it to us to make sure that we're delivering it in a way that works for us and our funders.
Thanks, Mary Beth. So Dr. Lessler, perhaps you can kick off with an answer for this question, and then I'd invite the rest of the panel. Keeping along the lines of alignment and coordination, we're seeing a lot of comments here that there is need for local tailoring within a practice, but what needs to be standardized as far as measurement, value-based purchasing, and things along those lines, and how do these opportunities support both standardization and coordination, as well as local, practice by practice tailoring and needs?
So I think I would begin by, in terms of standardization, saying that we think it's important to really be pushing for standard measurement. And one of the opportunities we have in the state is, through the Healthier Washington work, the creation of a common measures committee, statewide common measures committee, that actually has created a common measure set. And at the Healthcare Authority and through our work in Healthier Washington, we're committed to using metrics and off of the common measure set, and metrics, and especially any metrics that we would tie to value-based reimbursement. So, and we're working, more generally with other purchasers and plans to advocate for a similar approach, trying to create a single sort of signal that is going out to the practice community in terms of what should be areas of focus. With respect to practice, with respect to care coordination, this actually is one of the opportunities within the Medicaid demonstration. It's an elective area, but where there is a focus on care coordination. And what I would say, sort of writ large, is that I think there are, and as people would see in, if they looked at the toolkit that's available for the demonstration, there are certain principles or frameworks that are important to achieving optimal outcomes through care coordination. So I think we would, we're looking to see the presence of those concepts in care coordination. I think that the detail of how those actually are operationalized on the ground in a particular clinic can look, can have different appearances to them. But I think there are certain common principles that we would want to see people really building off of.
Thanks. Selena, do you have anything to add to that?
I just wanted to add that practices, of course, have federal initiatives that that they're paying attention to as well. And in terms of the measures, I think one of the things that we can do is align MIPS, MACRA, along with the state common measure set and the demonstration measures, so that practices can see that that improving clinical measures they can really use those for multiple kind of payer initiatives, which I think is really helpful as well.
Thanks, Lena. Dr. Bennett, we received a question about some of the tools and resources that are available or will be available on the portal. I'm wondering if you can go into further detail about that. And we received a specific question about whether local county data will be available through the portal. And if not, perhaps the panel could speak to where folks might be able to access data.
That's a great question. So the current, it was mentioned earlier that the portal is a living being that's under continuous revision and development, and that is a major part of the project. We really trying to develop functionalities that are most useful to the population, the group of clinics that we're trying to serve for this particular effort. So the current set of resources that we have are kind of your standard formats. They include prepared toolkits that are designed to help practices go through this practice transformation process. They also include a number of various kinds of background materials and various kinds of videos of successes so that people can get a sense of what kind of practices like theirs have been able to achieve. Our future, we very much want to include as much resources that are more local to really align better with the regional connectors efforts and the coaching effort. And so looking forward to version 2.0, which will be completed by the end of October. At that point, we will have built in some resources that are actually linked to more mapping, to a mapping kind of functionality that allows people to put in their zip code or something of that sort. We're still developing exactly the best way to do that. But you'll be able to, in kind of a Google Maps way, put in where you are, what kind of resources you're looking for, and it should then be able to populate with a number of resources that would help you with that. That's our current plan, and we should have some version of that available to you by the time we launch version 2.0. We are actually now putting on a set of resources that Qualis Health has put together that's kind of more statewide, and that catalog of information will help a bit with getting more local resources, but it's a more traditional catalog that requires kind of going in and looking things up more directly rather than getting into it through the mapping format. And Selena, I didn't know if you wanted to add a little bit of information about that catalog.
Sure, thanks, Ian. So that's a catalog of Washington or practice transformation resources that are available in Washington State. At this point, I think there's maybe 9 or 10 different organizations, including the practice transformation networks that Melissa talked about, and other technical assistance and resources. We will be building on that every quarter. So as Ian said, the first sort of PDF version of that catalog will be available on the portal, but we're continuously adding to that so that we make sure that we keep track of these sort of ever-changing resources to the benefit of practices and providers, so they'll know what those resources are to pick from.
So if you were to want to get those resources, you would go to the resource page on the portal and follow the steps that are laid out there in what's called a search wizard, where you're from, what kind of resources you're looking for, and then that catalog should pop up for you to allow you to get that information.
So, and I did want to speak to the aspect of this question, which has to do, I think, with really what sort of clinical data might be available on a dashboard. point out to people that actually on the Healthier Washington website, it is possible to get to a dashboard that is that's quite comprehensive and allows you to cut data any number of ways. And for example, just to compare geographically performance around measures that are on the common measure set. So that's a very powerful tool that I'd encourage people to take a look at.
Thanks, Dan. And you can access that on the website at hca.wa.gov/data dashboard. So we encourage folks to go check that out. We have time for one final question, and I think that everyone on the panel could speak to this, but maybe Dan, we'll start with you. There is, as Selena mentioned, there's MACRA, there's MIPS, you spoke to the demonstration. Why is it important for providers to pay attention, and what's in it for them as far as the kind of business case for their providers to move with kind of these system changes that are occurring, and I think with a final word on how practice transformation can support that.
So I think, I think just getting down to what's important to providers, it's the quality of care that is provided to their patients and their ability to provide high quality care. And I think that the movement to value-based payment really enables the kind of flexibility that ultimately the providers need to be able to best serve their patients. And frankly, when I talk to the provider community, I think they feel this very strongly. And I think the business case is that this is the way payment is moving. So it becomes critically important to be prepared to exist and practice in an environment that is really driven by rewarding outcomes ultimately, as opposed to fee for service. And I think in terms of what we're talking about here and the demonstration and the practice hub, I think we all recognize that there is getting from where we are today in a fee for service world to a value-based payment world. There's this gap, and it's how do we, what we're talking about, and really here is resources that are available to practices to bridge that gap so they can get to the other side where they have, they can exist in a value-based payment world. They do have more flexibility in terms of how they deploy resources, and they can achieve the best outcomes for their patients.
Thanks so much, Dan, and thanks everyone for joining the Healthier Washington quarterly webinar. We encourage you to check out the resources that we talked about today, and also access the Healthier Washington webpage for more information about data, practice transformation, the demonstration, accountable communities of health, and more. We also encourage you to join Healthier Washington's feedback network by emailing the email address on your screen. Thanks to our panelists, and thanks to everyone for joining today.